So fluoroquinolones are overprescribed in Nevada. They're one of the more common antibiotics that we see that are prescribed inappropriately. We have tremendous resistance to fluoroquinolones in this state. So in this section, we're going to review the issue of fluoroquinolone prescribing and adverse drug events associated with this class of antibiotics. So as we discussed before in Module 1, antibiotics can cause adverse events. And so with fluoroquinolones in particular, they can cause central nervous system issues like dizziness, insomnia, or confusion. They also are known risk factors for promoting the growth of Clostridium difficile, as well as promoting the emergence of carbapenem resistance. So this particular class of antibiotics is actually quite dangerous to use and really should only be used when we absolutely need to use them. As I mentioned earlier, we do have tremendous problems with antibiotic resistance, and we often see them prescribed without an apparent awareness of the degree to which we have resistance to this particular class of antibiotics. Food and Drug Administration issued a black box warning on fluoroquinolones recently, and what that means is we have to really think twice about ever prescribing this class of antibiotics. And the risk is really the greater chance of tendinitis and tendon rupture. And so that's a pretty serious thing, very painful thing to happen to a patient, and certainly an adverse event that we would like to avoid if possible. There have been serious side effects described now more recently in the 10 years it's been since they issued the initial black box warning, where we're seeing some pretty concerning side effects to fluoroquinolone here. So these are things that, if you think about the elderly patient population seen in the SNF care setting, many of these patients already have delirium. They might already have memory impairment, and now we're giving them a medication that could exacerbate that. So these are things we really need to keep in mind. Also, some of these patients are very sensitive to their blood sugar levels, and here we have a medication that might be associated with hypoglycemia that's serious enough to induce a coma. There have also been reports of a rare occurrence of ruptures of the aorta. And so again, we're dealing with pretty sensitive patients here, patients that are already at times frail. And so what we don't want to do is make sure we're using our medications appropriately so we're not precipitating another terrible medical outcome for them that is on top of whatever we're already dealing with in the SNF care setting. So again, fluoroquinolones are very commonly used, especially in Nevada, especially in the SNF care setting. But we need to be aware that we have significant antimicrobial resistance patterns for the fluoroquinolones. We've seen facilities that have susceptibilities down in the 30s for both Levaquin and for Cipro. And so that's very concerning to see. And on top of that, we have several black box warnings from FDA warning us about the adverse effects of this medication. So again, we want to be able to use fluoroquinolones only when we need to, because they might be the one antibiotic class left to a patient that we have. But right now, we're using it frivolously in many different care settings. And what that's doing is driving our resistance, but also driving the potential to have an adverse effect for our patients.